So welcome back to a very, very special episode of Walkin Talkin with Tim. So my guest today is the one and only Joe Devine. Now, Joe was with Kennedy Health Systems for 35 years in various executive positions, but ultimately the president and CEO of Kennedy Health. So, you know, I wanted to bring Joe on, and now Joe actually is partnered with another gentleman,
Rich Miller, former CEO of Virtua.
CEO of Virtua, and to form Miller Devine Leadership Advisors, which
actually works with senior level executives and boards to create better cultures and organizations and organizational strength.
And there you go. So Joe and I have been walking and talking about what's going on in the world, and especially in the healthcare world. And Joe has so much experience, like a very overarching experience in the healthcare world, that, you know, what I wanted to ask Joe about was, how does he see the future of healthcare evolving as we are in a post-pandemic state, as we're coming out of the pandemic? What do you see happening in our community, and what do you think is going to happen, you know, within the community, you know, as far as healthcare is concerned?
Sure. Well, first of all, Tim, thanks for having me. I've watched a few of these. You do a great job. I know you've had a few of my friends on recently, but healthcare has obviously had gone through a major transition. And for the last 35 years being part of it, it's gone through transitions multiple times. There's been multiple pandemics. Nothing as great as the COVID pandemic. Of course, we had AIDS, we had Ebola. We've had a lot of things over the years that have actually prepared healthcare in different ways. What I think's happened over the last 2 years is that healthcare will now adjust for the future, and will actually make sure that we're able to do things that we could not do during this pandemic. For example, we stopped elective surgeries, we stopped procedures, so people's health were impacted by that.
And nobody was going to the doctor.
People were not going to the doctors, they were afraid to go to the hospital. Matter of fact, emergency room visits, which historically were very high, were record lows, and that was not positive. So the question is, what was happening with people? Were they actually getting the right health treatments? Were they getting the right screenings? And the answer is no. The answer is that we need to do a better job as a healthcare community, and I think we've learned through this. And from what I have seen over the past 2 years, is that healthcare is actually now more prepared than ever for the next pandemic and the next thing will come. Of course, right now we want everybody to get vaccinated, which I know we spoke about before. But honestly, the healthcare industry in general is very well prepared, which we were not when it came to COVID, because it was an unknown virus. It wasn't something we knew a lot about, but it was something we had to learn about. And I think from now on into the future, you will see that the examples and things that we've learned from COVID will make the healthcare industry even more prepared to be ready to handle pandemics, to make sure people are safe, and to continue to operate on a normal basis, which we were not able to do during this COVID pandemic.
Yeah, well, the fact is that people weren't just not going to the doctor; they weren't going to the hospital to have procedures done. They weren't going to get checked out, and people weren't going for typical examinations that they should be getting to keep them healthy. Like, sections of hospitals, I was told, were shut down. Is that true?
Well, I would not say sections of hospital were shut down. I think certain procedure units were shut down. For example, where they needed a colonoscopy or certain types of procedures, they were shut down. But they were being used, the staff in those areas were being used for other things. And I think what we learned through this is that we need to continue to operate, and we need to be able to service everyone despite what comes about. And I think the pandemic was just such an unknown that in reality, until we learn more about it, the science was changing daily. But I think we've learned through this is that although the science is very, very important, what is ultimately important is the safety for all of our staff and all of our visitors and all of our patients at every turn, no matter what happens to us. So I think that's what's happened in the industry, that the industry is now very prepared to take on the next steps if something else comes about.
So what do you think that's going to look like as we roll forward? You know, I mean, obviously we're still wearing masks in some instances, and we've got some kind of conflicting information, as I said to Amy that day, that look, you know, some places are saying we still want you to wear a mask, some places are saying we don't. What do you think the future is going to look like for our communities, especially in New Jersey, where we are, right? New Jersey, Philly area. What do you think the future is going to look like for us over the next, like, I'd say 6 to 12 months?
So I think the one thing that the pandemic did is it brought institutions closer together to be more collaborative, because we were all in this together. Healthcare was all in this together. Historically, healthcare organizations are a little bit competitive, but honestly, The bottom line is if we don't collaborate and they don't work together, it will not help the health of the community. What I think will happen post-pandemic, and it will continue to, is you'll continue to go to your physician's office or the hospital, where for the next foreseeable future, you'll see people masked and gowned in the hospital environment.
Right.
Because COVID is not going away. Yes, we have the vaccine and we've done some things to help improve that and with some of the protective equipment. But I think what's going to happen is you will see this for a sustainable future, where you might go to your doctor's office now. He may still keep a mask on and he may ask you to put a mask on. I tell you a very interesting story. The young lady who cuts my hair spoke for years that every holiday she ended up with the flu. She ended up with the flu because people would come and say, oh, I need my hair cut before Christmas.
Not last year.
And some of them would come in and they'd be sick with flu.
Mm-hmm.
Well, this year, even though she was cutting hair, they had masks on.
Mm-hmm.
It's the first Christmas she did not get sick. So I think what you're going to see is an environment where people will select to wear masks that they haven't made them before. And it'll be an individual decision in certain locations. But in hospitals, I think now into the foreseeable future, it's going to be a requirement until we make sure that we have the right protocols in place and right procedures to protect everyone.
Yeah, I've noticed that, I haven't heard anybody tell me, in the past probably 6 months that they've had the flu.
Yes.
Flu
nobody. Numbers are down dramatically, of course.
You're washing your hands, you're wearing a mask.
And that's a good lesson everybody learned also, how important washing your hands is. And that was something we knew in healthcare.
And hey, personal distance, right? Like personal space, right? The close talkers, like in Seinfeld, it's just...
So I think that's important, but it's also important to have that human connection. I think we've missed is a human connection. But I think what people learned is washing your hands is important.
Yep.
If you're sick, don't cough on someone or come to work. Stay home from work.
Exactly.
We've proven that people could actually work from home.
Yeah.
And I think what has to happen is we have to have a different philosophy about how we approach illness in this environment and in any work environment, but in the country in general. But I'm really feel strongly that the healthcare industry in general throughout the country, and especially the collaboration that's happened in South Jersey, will actually make the care better for patients. Because no one's in this alone. This is a whole united front of how to attack this. And another example of that is the mental health crisis.
Right.
We've only seen the tip of the iceberg of how mental health is starting to evolve, especially when it comes to illnesses that will come out post-pandemic.
And that's a tragedy. That's a super tragedy.
It is. So we need to be able to service it better and be able to treat it better. And I think the hospitals will work together throughout the region, throughout the country, to figure out how to make sure we're better servicing these people in the right way and in the right environment.
Any additional thoughts you think that might help out folks that are wondering what their next steps are, and as far as looking for good health care, or maybe even how healthcare is going to evolve for them personally? Because I think right now we still are kind of fighting with whether or not we're going to stay with a private or a public healthcare system, right?
Well, I think you're still going to be with a private healthcare system. I don't think it's going to be a public system for the country. I don't think that works. I think if people in this country are used to getting care, for example, in certain countries of the world, you might have to wait 6 weeks for an MRI.
Right.
Well, that's not something Americans are used to. So I think what you need is a couple things. One, everyone needs a primary care doctor.
We're going to make a turn.
That's vitally important, having a primary care doctor.
Right.
Because they know your health. They're able to navigate your care for you, and that's a very fundamental thing, because the emergency department is not where you should get primary care. And I think the lesson is learned from this is that people have opted that they could take care of some things on their own, and I think when it comes to having a physician, a primary care physician is important because they can help navigate your care for you.
Right.
So I think that's important for you also. And I also think that the thing that's really emerged out of this has been amazing to me is the applications for nursing school and medical school are up. You would think that people were scared of the pandemic,
right?
But I think what it did is it actually brought to the forefront of how really healthcare workers are truly heroes. And it didn't matter whether they're environmental service workers who were in patient rooms every day trying to clean them, whether you were in food services, whether you were a nurse, whether you were a physician. And all those roles were vitally important, and I think you're seeing an increase in this, which I think is great for the country.
Right.
And I actually think it's great for our community because as we all age, we want to make sure we have people there taking care of us.
Listen, I'm not aging.
I know you're not. You're going to keep staying young, which is good.
I just lost 40 pounds.
I know, it's all this walking.
I want to stay here, right?
It's all this walking, which is great, right? It's a great walk and it's a great night. So
I want to enjoy it for a while. Yeah, truth be told, I made Joe walk like 10 miles.
Just to get to this point, by the way. But I will tell you that I think that we should be very proud of the healthcare that's offered in South Jersey. It's across the board, and I think that there's a lot in the communities could be thankful for. And you don't necessarily need to go to Philadelphia to get outstanding healthcare. No. You can get it right here in New Jersey.
That's right.
And there will be occasions where you need to go to the big academic medical centers in Philadelphia. Then that's just because they might have a niche specialty for people. Right. But honestly, the care you need can be provided here, and I think New Jersey has proven during the pandemic, and South Jersey especially, that they've been able to handle all types of crises through this process.
Well, as always, an incredible guest with lots of great information. I want to thank Joe for being on today. And thank everybody for watching. Listen, we wouldn't be here if you guys weren't watching. We wouldn't be here if you guys weren't following along. So thank you for that. We appreciate you watching. Stay strong, stay positive, keep on moving, and we will see you next time on Walkin' and Talkin'.
It's a good walk. It's a good walk and talk. Enjoy, Tim. Thank you so much for having me.